if you are watching this video, this is Dr. Grunch. I'm giving you your post-operative instructions after a cervical disc replacement. Cervical disc replacement is a surgery that we do when we make an incision on the front of your neck and we go in and remove the bad disc in your neck, either one or two discs. And then we put in an implant that preserves the motion in your disc. So I'm going to go through the do's and don'ts after surgery and kind of my usual protocol for how I want you to take care of everything after surgery. So normally after the surgery, you'll either go home the same day of surgery. If you're at the surgery center, you'll go home the same day. And most people do go home the same day. If there's some extenuating circumstance, we would keep you overnight. You will get discharged with a few prescriptions, usually a pain medication that you'll take as needed for pain. You can take it every 4 hours. A muscle relaxer, which will help with the tension on the back of the neck because it's pretty common to have muscle type pain back there. And then a medicine called meloxicam, which is an anti-inflammatory. If you can't take an anti-inflammatory for some reason, that's okay. But that medication may prevent bone formation over the implant. So I do prefer that you take some kind of anti-inflammatory for every day for a month if you can. So those are the prescriptions you'll take. You'll want to eat softer foods after the surgery because we do have to move your esophagus over to get down to your disc. And so you may have some trouble swallowing for, either a few days to up to a few weeks. That's pretty normal. If you're having any severe trouble swallowing, please let my office know and we can call in some steroids. That's pretty uncommon, but can happen. So stick to softer foods. Don't eat things like steak and chicken for a few weeks because they may want to get hung up. The incision has skin glue over it. Usually I do not put a dressing on it. So that glue will flake off over a period of a few weeks. And then you can shower in 24 hours after your surgery. The incision can get wet, pat it dry. And then after the glue comes off, you'll notice just the scar there. And I usually try to put that scar in a natural skin fold in your neck. So when it heals, it'll kind of fold in with the natural crease in your neck. You can put silicone strips or silicone gel that you can buy at Amazon over that incision to help the scar heal nicely for a more cosmetically appealing long-term benefit from the scar. Also, please, for the next few months, make sure you put sunscreen over the incision anytime you're in the sun. It's just good habit to do it maybe every morning just because your neck always gets exposed to UV light, and that'll help the incision heal and fade back to your natural skin tone, because if it does get sun exposed, it may change the melanin a little bit and be more apparent in the long term. So please remember to do that. You do not need a neck collar. I don't have patients wear a cervical collar after the surgery. You can turn your head side to side and up and down to what's natural, what feels normal. If you turn it and you feel pain, just kind of don't turn it past the point of pain. And then as time goes on, at the 6-week mark, we'll send you to physical therapy to work more on the range of motion. But for the next few weeks, really just trying to move your head around as much as what you feel is comfortable. In terms of lifting, I don't want you lifting any objects above your head. So like dishes, laundry, or anything above the head lifting, try to avoid. That'll just make the muscle tension in your neck tight. You can do your hair and that kind of stuff, but don't lift anything more than 10 to 15 pounds. And that's the limitations for after surgery. You'll have a post-op appointment with one of my physician assistants, usually at the 4 to 5 week mark post-op. We'll get x-rays then, and then we usually get a series of x-rays over 3 to 6 months. And then if you're doing well at 3 to 6 months after surgery, you don't need any more x-rays or really any follow-up if you're doing okay. It's normal to have, like I talked about, the sore throat and a hoarse voice and trouble swallowing. It's also very normal to have pain and tension in the back of your neck, because when we have the disc that we remove and we kind of increase the height of the disc space, it stretches all those muscles. So those muscles may be very tight. And that usually dissipates within, a few weeks to a few months. And then we'll start you in physical therapy at 6 weeks if we feel that's still a problem and you need to have some more like even dry needling or massage or treatments to those muscles to help release the tension if it's still a persistent problem. With that being said, you can ice back there, heat back there right after surgery, nothing on the front. But back there, massage, anything to help relieve that muscle tension is totally fine. I also pull your shoulders down during surgery to see with x-rays. So there's some natural tension that will be from just us maneuvering you during the surgery that will be present. If you have any severe arm pain, that's not usually normal. So let us know if you're having bad radicular or shooting pains down your arms. Just call the office if you have any questions or concerns whatsoever. I'll send you a separate video about your specific surgery. Again, these are just general guidelines after a cervical disc replacement. And I hope you get better from this surgery, and have a wonderful day.